Hello everyone, welcome back to the IDRiM podcast. And uh, this time we will still with ADN for their global campaign International Awareness Day for Avoidable Deaths or IAD4D. In this episode, we will have cases from Pakistan that will tell their stories on the global campaigns, which is Mr. Asad and Mr. Hira. Then I will ask them to first introduce themselves and their role in ADN, and then after that they can also explain what is their role in this global campaign this year.
I'm Asad Tahir. I'm currently enrolled with University of Leicester, England. I'm a PhD student in my 4th year now, almost concluding in 6 months from now. I've been associated with ADN for the last almost 3 years, and as a pro bono regional coordinator for Pakistan chapter. And 2 years earlier, we have celebrated International Awareness Day both here at University of Leicester main campus. We've been lighting up the Attenborough Tower, named after the great Attenborough family, one of which is Sir David Attenborough, the famous BBC broadcaster and natural environmentalist. And I also have linked my campus back in Pakistan, which is Pearls Education City, created and established in my hometown with about 1,500 students and 100+ faculty member. They have also become partner to ADN, and it is at the campus that we have engaged and mobilized our student volunteers and staff and management to actively champion the agenda and vision of ADN for the last almost 3 years now, because they celebrated back in 2024, similarly back in 2025, and now this will be the 3rd consecutive International Aware Day that will be celebrated on campus. This time around, we have picked up road safety as our theme, because in our rural marginalized district, we have massive incidents or leading to severe injuries and many a times fatal accidents that lead to death of the people involved. And the awareness campaign, we think, should start from students, particularly minor motorbikers. They need to be sensitized to follow road safety, road behavior, avoid rash driving. For this, we have already we have informally kicked off our International Aware Day campaign a week ago. We invited district police officer at our campus, and he held a detailed seminar. He addressed the entire joint assembly of adult, boys and girls from class 5 onward. He talked to them. He gave them briefing, not only a responsible behavior in this overall digital environment, ensuring their cyber safety in this virtual world, but also he explained his vision about road safety, safe behavior, safe driving, the consequences of rash and reckless driving on the road. He also addressed minor bikers and sensitized them about the advantages of using helmet. So that's the beginning, where we have already kicked off our campaign for this year 2026. We have other activities already planned. We are trying to identify some volunteers based on the seminar by the DPO we have already been contacted by some motivated and inspired students who want to take the message to other campuses of the city. They will also join, they'll be joined by our faculty members and a member from our management. They'll make a team of 6 to 8 people who will visit other campuses, colleges, and high schools. And they are designing one-page short brochure with ADN assets, logos, and insignias, and the message, the tagline for the 2026 campaign. And that brochure will be distributed to students whom they will be addressing and sensitizing about road safety and avoiding reckless and rash driving on the road, and thus saving lives which can be avoided. I mean, it is basically avoidable deaths. So we really are hammering this year the theme of road safety.
The following part of the interview has some connectivity issues where the sound occasionally drops. We can only apologise for this.
First, I want to introduce myself. I'm Tahira Khan, and I'm working as District Emergency Officer in Punjab Emergency Service, Rescue 1. And we have been working in different dimensions. We have been dealing every kind of emergency. We are responding to medical emergencies, fire, and any kind of emergency. You can say we are responding to all of them, and we are rescuing people, and then we are shifting them to hospitals. We are also running the patient transfer service, in which we are dealing with different patients and we are transferring them from one hospital to higher medical facilities in other cities. And at the same time, we are also working on prevention as well. We have been for safety in my district. Actually, Sarasat and me, we are working in the same district here. We also coordinate different activities, in fact, for the road safety seminars and others. And we have been working with the building owners, and we have been working for the safety of high-rise buildings, especially for fire safety. And we are conducting different types of first aid trainings as well to aware the students and general public, and we are training them on basic life support, and the basic first aid, so they could help themselves and their family members or anyone that they see during any road traffic crash or any other emergency. So we are working in different dimensions. So Sir Asad was the one, and I'm thankful to him. He was the one who introduced me with the ADM, and he was the regional coordinator for Pakistan. And then he introduced me, and then ADN also nominated me as the regional coordinator. And we have been working together since long. In fact, Sarasad and me, we were working initially on a model village project that was, the village of Sarasad, and we have been working in, different things. We were planting trees, we were giving awareness to volunteers. We have set up a first aid center, and we have been working for different social, and that created a huge change over there. So now I'm with ADM, and together we are working for road safety, and we have been conducting different awareness sessions, seminars, and we are also working in. And in 2025, ADN also awarded me, nominated me for the ADN Hero Award. That was because of the prevention activity I have carried out in my district in the agricultural wells. The Pakistan is in here at Chiniot, we have more agricultural lands, and the farmers are using agricultural wells to irrigate their lands. but there were no safety measures. So often these feet deep, and often little children and even the farm animals fell in these wells and they lost their life. So I have taken a safety measure that is, easy to adopt, and we have motivated the farmers, and then they have started working on that. And up till now, we have made safe more than 1,400 agricultural wells. That's why ADN nominated me for the ADN Hero Award. They have given me that award. And so this is all about me. I have tried to summarize what we are doing here in Geneva. Thank you very much.
Thank you. So actually, I wanted to talk a little bit more about your ADN awards. So you've fantastically explained, why you received it. But I wanted to ask you, how did it feel to receive this award? And also in your community, does it feel like that this is showing good practice?
I think when you receive some award, this increases your responsibility. That was your accountability, and you became more responsible, and you feel strengthened as well because you're motivated. But at the same time, I feel that now I have more responsibility. I have to make aware more, volunteer. I have to give awareness to more volunteers. We have to, expand the span of these activities, because, prevention, we are, responding to emergencies, but in fact, we have to work towards prevention, because, hero is who will save the whole world in one day. I think you are a hero when you can save even one avoidable death. So I think now I feel that I have to, give more time towards prevention, and I have to do more, and I have to work with my youth, and so they also become heroes for their society.
Thank you for the answers. Stahira, I want to go back to Mr. Asad again. As you mentioned that it's been 3 years of having this campaign actually on International Awareness Day of Avoidable Deaths. Do you think there is a chance that you can actually feel or perhaps observe by having this global campaign, whether the awareness of the avoidable death increasing, or there are some activities that actually support this, and we have been regularly connected through years, or there always something new year to year between the first years in 2024 and now with your focus on safety in these years?
Basically, I'm engaged with ADN at many levels. This international awareness campaign is only one component that I'm part of. At the very strategic level, I'm also now part of ADN Santiago network. I'm also invited at various talks organized by Institute of Environmental Futures, University of Leicester, where Dr. Nivedita is deputy director or deputy lead on the IAEF. There are morning cafes that I talk to, students who are working around disaster and crisis management. I'm also privileged to write proposals for ADN UN OCHA annual partnership week at Geneva. My proposal was accepted last year. That was around the role of social media in crisis communication. I chaired the session with 3 other international technical experts on the subject of crisis communication. And fortunately, again this year, my seminar, my webinar has been accepted. The proposal now this year around, it revolved around climate crisis is communication crisis. So that's one of my assumptions, because my PhD is around leadership and crisis communication. So I already delivered a talk as a panelist in the wake of COP30 webinar symposium that was arranged in person, a symposium at Space Park, Leicester, that was also hosted by Institute of Environmental Futures, which is headed by Dr. Heiko, and Dr. Heiko is the main environmental scientist at the University of Leicester, who represents university at various international fora, including COP 20, be it 29 or 30 or next year 31. So he was at Brazil. He came back with learnings from the COP30, and then he wanted to share those learnings. And we arranged a symposium. I was also one of the panelists. So my engagement with ADN is manifold. And I'm part of the key strategic discussions which keep happening around broadening the vision, broadening the scope. And in the last 3 years, I've seen ADN expanding by leaps and bounds, maximizing its visibility, maximizing its outreach to almost all continents on the planet Earth. And now the numbers are increasing. We probably have already crossed 1,000 volunteers registered with ADN from across the world. And it is so very reassuring that a very small intervention by basically two individuals, Dr. Nivedita and Edioke from Kansai University, Japan. Now it has already transformed into a global campaign and a global call to action. And the call to action always hammers themes which can reduce the numbers of avoidable deaths, which could be avoided, be it well drowning, or be they snake bites, or road accidents, or natural disasters like cyclones, or earthquakes, or floods, or anything. So the vision is supreme. I mean, there is nothing nobler to me than saving a human life. And when you are trying to put together a massive campaign for reducing the avoidable deaths, particularly in the global south, where poor countries are mostly struggling with basic resources, awareness, spreading a word, maximizing visibility in this part of the world where they are already struggling with meager resources, at times only to make both ends meet for their daily living. Bringing in these interventions, then another very important feature of ADN is bringing in international experts, bringing in subject specialists, crisis communication specialists, crisis and risk managers, who could always build synergies, establish partnerships with institutions like Punjab Emergency Department, where Madam Tahira works back in Pakistan. That is exactly how I nominated Madam Tahira to join us, because that is basically bringing in people who are relevant, who share the same vision, who are working in the similar areas, which are emergency management or crisis and risk management. So this is a massive vision. I'm always so excited that the vision is transforming into tangible, concrete achievements, and that is always reassuring to be associated with ADN.
Okay, so one last question for myself, and so a bit of context about the ADN is I actually remember its very launch event I attended back in 2019 in Kyoto, and I'm very impressed of in that short period of just under 7 years of how much it's grown. How important do you think the International Awareness Day for Avoidable Deaths campaign is, in your country?
Yeah, I mean, absolutely, it is very important because the value of saving lives is very important. When we tell people how important life is and how important our own engagement, community mobilization, institutional involvement, be the educational institution, emergency managers like Madam Tahira, their department, then the stakeholders engagement like road traffic police, for example, they are very important. District police officer, as now he is the head of district police. He has already been contacted. He was told about ADN and this vision, and he was very happy to visit our campus where we are kicking off our this year campaign. So it is basically maximizing visibility. It is engaging with the relevant stakeholders, key stakeholders like traffic department, police department, emergency services department like Madam Tahira, educational institutions, students, staff, teaching faculty, management. So it is a holistic campaign. It is basically the entire community and different walks of life and key stakeholders with which we engage, we maximize our presence, we send the message across, and when we hold seminars, awareness sessions, we train volunteers, and that's basically sending the message across. So it is absolutely very, very important and very, very vital, not only to spread the word, but also to contribute to a vision that is global. So a vision could be global, but it could always happen on the ground at a very small scale through local engagement, through local action. So if I sum it up, the vision of ADN could be global engagement, local action. So we are globally engaged, but locally active. We are trying to do our small bit within our own communities, within the available resources, technical, human, and financial, to translate the vision into reality.
For Ms. Tahira, as an ADN hero, do you have any message for the people of the world, especially and the listeners, about how to contribute to this year global campaign, and in particular, how to campaigning avoidable deaths?
Thank you, Aris. For the message, I want to say that if each of us commits to identifying one risk in our community and reducing it, our cities and villages will become safer. And it's not rare. It's about responsibility. So for the global campaign, we we are doing awareness sessions, and we are here on 12th March, and we'll be engaging the youth. I think are not the beneficiaries of resilience. Basically, they are the architects of resilience. So we should engage more youth, so we could our cities and our villages could become safer. Because risk is not evenly distributed. In cities, we have different risks, and in villages, we have like different risks, like agriculture, wells, and different things. In cities, we have high-rise buildings, fires, and everything. So I think we should engage youth at each and every level. So we are doing this through our ADN campaign on 12th March and at the International Awareness Day, and we are doing it on a daily basis. Even in Geneva, my team is training youth in schools and colleges. So we are engaging them as volunteers, and we have also worked to we have started a volunteer system of emergency management here. Also engaged some volunteers from villages where the emergency ratio was high, and we could respond. Our response was a bit late because these were rural villages. Now these volunteers have been trained, and now they are responding to the road traffic crash and medical emergencies in their villages. They dash to our control room, and whenever we receive an emergency call, we dispatch the ambulance, but at the same time, we call them as well, and they also respond to the emergency. And in this way, many lives are being saved because in a road traffic crash, bleeding, we control the bleeding, we can save life. So they respond, and at the same time, we also read there, and then together with their help, we shift the patients. And this is changing the mindset of the youth. When the other young people who are residing, when we showcase their efforts on our social media platforms, the other youth is attracted toward this message, and we could engage more of them, and we could engage more volunteers, and this will bring more positivity. The youth will not engage more in other activities, in useless activities. They will become more socially responsible, and they will think that we have this responsibility, and in their society, and we could train them. I think they could bring a huge change in their societies. So through this International Day campaign on 12th March, and with the launch of Junior Champion magazine, we'll try to achieve these objectives to prevent and to save, avoidable, and to reduce avoidable deaths.
Thank you very much for your answers. And again, thank you for coming here, Mr. Asad and Ms. Tahira. Hopefully all your efforts in your regions can inspire and move all the people that to bring their awareness more and doing actions given this global campaign this year. And hopefully more people will know at the end and expand their collaborations across the world. Thank you again.